Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an overview of laparoscopic pain mapping as a diagnostic tool for identifying the source of chronic pelvic pain in women. Now read the question.
Laparoscopic pain mapping is a diagnostic laparoscopy performed under local anesthesia, with or without conscious sedation, aimed at identifying sources or generators of pain in women with chronic pelvic pain. At times, finding the cause for pelvic pain becomes very difficult. This is especially true in cases of pelvic scar tissue, endometriosis, fibroids, and other issues that can be explored through a pain mapping procedure. The patient is given some strong medication to make them drowsy. After injecting local anesthetic medicine into the navel, the physician will insert a small bubble of gas inside the belly and introduce a laparoscope, a very tiny diameter instrument, inside the belly to look around. Another small instrument is inserted lower down on the belly and used to touch organs inside. After the patient awakens, they will indicate whether they experience pain when specific organs are touched. For instance, if endometriosis is causing pain, it will be tender when touching the affected organ with the instrument. Moreover, when the patient experiences pain on the right side, it can be difficult to distinguish whether the pain is in the ovary or the appendix. Therefore, pain mapping can help identify the exact source of pain and assist the physician in choosing the appropriate procedure.
Now look at question 26. You hear a healthcare provider discussing recent findings on interstitial lung disease. Now read the question.
Interstitial lung disease is an unusual but sometimes deadly form of continuous scarring of lung tissue. New research by a cardiologist has shown that the condition may be linked to low vitamin D levels. Calcidiol is the biologically active form of vitamin D that is hydroxylated by our kidneys to form calcitriol, which circulates as a hormone in the blood, playing a major role in regulating the concentration of phosphate and calcium. Its anti-inflammatory effects modulate our immune system and also have anti-fibrotic effects, regulating various genes involved in fibrosis or scarring. Therefore, if you have low levels of vitamin D, that may be a contributing factor for the lung disease. However, many cases of interstitial lung disease aren't related to any particular factor. Thus, vitamin D levels might be an unusual risk factor that is relatively easy to evaluate. New research will focus on correcting vitamin D levels, and then assessing whether the patient's condition resolves or stabilizes. We know that the activated vitamin D hormone has anti-inflammatory properties and helps regulate the immune system, which can be disrupted in interstitial lung disease. There is also evidence in the literature that vitamin D plays a role in obstructive lung diseases, such as asthma and COPD. We have now found that this association exists with this scarring form of lung disease as well.
Now look at question 27. You hear a healthcare professional explaining pyloric stenosis in newborns. Now read the question.
Pyloric stenosis is a problem that affects babies between birth and 6 months of age and causes forceful vomiting that can lead to dehydration. It is the second most common problem requiring surgery in newborns. The lower portion of the stomach that connects to the small intestine is known as the polaris. When the muscles in polaris thickened, that narrows the opening of the polaris and prevents the food from reaching the intestine. This kind of narrowing of the lower portion of the stomach is known as pyloric stenosis. Typically, this problem occurs in newborn children between 2 to 8 weeks of age. As the polaris thickens, the stomach opening is blocked. Therefore, the food cannot move into the intestine. This causes a patient with pyloric stenosis to vomit, which could result in several problems. Dehydration is the major problem caused by pyloric stenosis, since the regular vomiting devoid the fluids for the nutritional need of the infant. Secondarily, minerals such as potassium and sodium are lost through vomiting, making the baby weak. Mainly the firstborn male babies are vulnerable to pyloric stenosis. Smoking or intake of tobacco during pregnancy doubles the chance of pyloric stenosis in infants. Bottle feeding is also another cause for developing pyloric stenosis. According to findings, infants giving antibiotics in the first 15 days of their birth have the greatest risk.
Now look at question 28. You hear a cardiologist discussing the impact of testosterone levels. Now read the question. According to research conducted by a cardiologist, higher levels of testosterone in postmenopausal women is the main cause for their cardiovascular disease. Higher testosterone level has been suggested to be associated with increased risk of cardiovascular disease, increased triglyceride insulin resistance, and increase in the risk of developing breast cancer in postmenopausal women. Testosterone is a type of hormone known as the androgen in the male. Therefore, a higher level of this hormone in women causes high blood pressure, adverse lipid profile, and other unforeseen health issues. Usually, testosterone becomes more dominant in women after the menopause. However, screening for hormone levels during such health conditions is not in practice at present. Symptoms of an excessive level of testosterone in a female include excess facial and body hair, deepening of the voice, acne, increased muscle mass. Female androgen insufficiency, which is characterized by the presence of reduced androgen level in circulation, leads to an impairment in sexual drive, reduced libido, depressed mood, and signs and symptoms of limited androgen exposure, such as decreased muscle mass, reduced bone density, and decreased sense of well-being. An appropriate level of androgen may play important roles in metabolic, psychological, and sexual functions in women. Now look at question 29. You hear a discussion about a multidisciplinary approach to managing pain without the use of narcotics. Now read the question.
Hello, doctor. Is there a comprehensive approach to keeping pain under control, avoiding narcotics?
According to a pain expert who has established a multidisciplinary pain clinic engaging physicians, acupuncturists, massage therapists, psychiatry arrests, and patients to kick the opioid habit, one fundamental practice followed is signing an actual contract with a patient mentioning that they will not use any kind of narcotic while they are getting prescriptions. Moreover, they will also not do anything outside of getting another prescription from any other provider. We will tell them that we will be randomly doing urine examination, and we tell them if they keep getting positive urine tox screens, we are not going to provide them medical services. So then they have to go and find another provider. Occasionally we get a positive tox screen and we confront the patients, reminding them not to use narcotics again. And we warn them, if it happens next time, they cannot come to our clinic anymore.
Now look at question 30. You hear a doctor explaining the dual role of information. Now read the question.
Hello, doctor. What can the nose information teach us about how the human body repairs itself?
We have the ability to smell things because of our olfactory system. However, according to research by a utility or just for the patients with chronic sinusitis, inflammation on overdrive compromises the system. The greatest problem in patients is just the ability to smell due to inflammation. As in the case of chronic sinusitis, for instance, it's evident that chronic inflammation is bad for the olfactory system, at least in the early stages. To begin their repairing processes, it is surprising that inflammation actually plays a beneficial role in early repair of tissues that allow us to smell. Therefore, inflammation is a normal and essential process in repairing. But the question is how to regulate inflammation to preserve the good and mitigate the bad.